I'm going to tell you something that might make you uncomfortable, but if you stay with me until the end, I promise you'll understand why the conversation we're about to have isn't just about sexual function. It's about reclaiming power over your own body, understanding the intricate relationship between what you feed yourself and how you experience pleasure, and dismantling one of the most persistent myths in modern wellness culture, that female sexuality peaks early and declines inevitably. That's a lie, and today I'm going to show you the clinical evidence that proves it. Before we go any further, I need you to do something for me. Subscribe to this channel right now, and down in the comments, tell me, have you ever been told you were too strong to truly enjoy intimacy? I want to know. Because what I'm about to share with you challenges everything you've been taught about desire, arousal, and the relationship between nutrition and sexual vitality. My name is Dr. Valeria Montes, and for over 2 decades I've sat across from women who whispered their deepest fears about their bodies, their pleasure, their worthiness of experiencing joy without guilt. Women who believed that after a certain age, after certain life events, after certain disappointments, their capacity for physical pleasure had somehow expired. I'm here to tell you that's categorically false, and the science backs me up completely. Let me start with something that might surprise you: the quality of your orgasms, the ease of your arousal, the vitality of your sexual response. All of these are profoundly influenced by what you ate 6 hours ago. Not 6 months ago, 6 hours. Your body is that immediate, that responsive, that willing to work with you when you give it what it needs. The problem is that most of us have been feeding ourselves like we're trying to survive, not like we're trying to thrive. And there's a massive difference between those two states, particularly when it comes to sexual function. I had a patient, let's call her Diane, who came to see me at 53, convinced that her lack of desire was simply menopause doing what menopause does. She'd read the articles, heard the stories, accepted the narrative. When I asked her to walk me through a typical day of eating, she described what millions of American women describe: coffee for breakfast, maybe a granola bar, a salad with fat-free dressing for lunch, another coffee in the afternoon, chicken breast and vegetables for dinner. Clean eating, she called it. Disciplined eating. I called it systematic nutritional deprivation of everything your sexual response system needs to function. Your brain, your nervous system, your hormonal cascade, your vascular system, all of the biological machinery that creates arousal and facilitates orgasm, runs on very specific fuel. And when you withhold that fuel in the name of virtue, in the name of thinness, in the name of discipline, you're not being virtuous. You're being cruel to a body that desperately wants to serve you, if only you'd let it. Let's talk about what actually happens in your body during sexual arousal. This isn't some mystical process that defies medical explanation. It's neuroscience, it's vascular biology, it's endocrinology. When you experience arousal, your hypothalamus triggers a cascade of neurotransmitters: dopamine, norepinephrine, oxytocin. These chemicals don't materialize out of thin air. They're synthesized from amino acids that come from protein. Real protein, not the anemic portions most women allow themselves. Simultaneously, your parasympathetic nervous system has to be calm enough to allow blood flow to redirect to your genital tissues. If you're running on cortisol and adrenaline because you haven't eaten enough fat to stabilize your blood sugar, if you're in a chronic state of nutritional stress, your body interprets this as danger. And bodies don't prioritize sexual function when they think they're in danger. It's that simple and that devastating. The blood vessels in your clitoral and vaginal tissues need to dilate. That dilation depends on nitric oxide production, which is directly influenced by the amino acid L-arginine and adequate intake of antioxidants like vitamin C and E. These aren't optional nutrients for good sexual function. They're essential. Yet I meet women every single day who are trying to experience pleasure while systematically depriving themselves of the building blocks their bodies need to make pleasure possible. Here's what I want you to understand. When we talk about erections like you're 20 again, we're not being nostalgic or metaphorical. We're talking about clitoral engorgement, vaginal lubrication, the physical capacity for arousal that doesn't require 20 minutes of mental gymnastics and physical stimulation just to begin. That kind of response is still available to you. But it requires that you stop treating your body like an inconvenient machine that should run on willpower alone and start treating it like the sophisticated biological system it actually is. So what do you eat before sexual activity to optimize your response? Let me be specific, because vague advice helps no one. You need protein, you need healthy fat, you need specific micronutrients, and you need them in combinations that support rather than hinder sexual function. First, protein. Not the palm-sized portion of chicken breast that weighs 90 grams, real protein. Your body needs approximately 20 to 30 grams of complete protein containing all essential amino acids to support neurotransmitter synthesis. That means eggs, whole eggs, not just whites. That means fatty fish like salmon or mackerel. That means grass-fed beef if you eat meat. That means full-fat Greek yogurt if you tolerate dairy well. The amino acids tyrosine and tryptophan, which are precursors to dopamine and serotonin respectively, come from these protein sources. Without adequate protein, your brain simply cannot manufacture the chemicals that create desire and pleasure. I had another patient, Rosa, who told me she'd lost all interest in masturbation, in sex, in physical pleasure of any kind. She was 57 and attributed it to aging. When we did her blood work, her protein markers were so low she was borderline malnourished despite eating what she thought was a healthy diet. She was consuming maybe 40 grams of protein daily when her body needed at least twice that. Within 6 weeks of increasing her protein intake to appropriate levels, she reported a return of spontaneous desire she hadn't experienced in years, not because protein is magic, because protein is necessary. Next, fat. And I mean real fat, not the traces you get from cooking spray or fat-free dressing. Your sex hormones, estrogen, testosterone, progesterone, are synthesized from cholesterol. Let me say that again for the women in the back who have been taught to fear fat. Your body makes sex hormones from cholesterol. If you're eating a fat-phobic diet, you are literally depriving your endocrine system of the raw materials it needs to produce the hormones that drive sexual desire and function. You need sources of omega-3 fatty acids because they reduce inflammation throughout your body, including in your vascular system, which directly impacts blood flow to genital tissues. You need saturated fat because it supports hormone production. You need monounsaturated fat because it improves insulin sensitivity, which matters more for sexual function than most people realize. Chronic blood sugar dysregulation creates inflammation and oxidative stress that damages the delicate blood vessels responsible for clitoral engorgement and vaginal lubrication. Practically speaking, this means eating avocado, olive oil, nuts, seeds, fatty fish, butter from grass-fed cows, coconut oil. It means abandoning the low-fat dogma that has harmed women's health for decades. It means understanding that when your grandmother ate real butter and lard and had robust sexual function well into her later years, that wasn't despite her fat intake. It was partly because of it. Now let's talk about specific foods and compounds that have clinical evidence supporting their role in sexual function. This is where it gets interesting, because some of these you probably have in your kitchen right now, and some of them you've been avoiding because diet culture told you they were dangerous. Dark chocolate. Real dark chocolate, 70% cacao or higher. It contains phenylethylamine, which your brain also produces when you fall in love, and flavonoids that improve vascular function. A square or two of quality dark chocolate about an hour before sexual activity improves blood flow and mood. But not the sugar bomb milk chocolate that spikes your insulin and crashes your energy. Dark, bitter chocolate that tastes like something with actual medicinal properties. Watermelon. This surprises people, but watermelon is rich in citrulline, an amino acid that converts to L-arginine in your body, which then converts to nitric oxide, which dilates blood vessels. Studies have shown that watermelon consumption improves erectile function in men. The same mechanism applies to clitoral engorgement in women. A couple of cups of fresh watermelon is actually a legitimate pre-sex food, though I recognize that's not the sexiest recommendation you've ever heard. Maca root. This Peruvian adaptogen has solid research behind it for improving sexual desire and reducing sexual dysfunction, particularly in postmenopausal women. It doesn't work by directly affecting hormone levels, but rather by supporting the hypothalamic-pituitary axis, which regulates your entire endocrine system. You can add maca powder to smoothies, and the recommended dose is typically 1 to 3 grams daily, though you should start low and increase gradually. Oysters aren't just an old wives' tale, they're extraordinarily high in zinc, which is essential for testosterone production. Yes, women need testosterone too. It's crucial for libido and for dopamine synthesis. 6 oysters contain more zinc than most women consume in a week. If you don't like oysters, pumpkin seeds are also zinc-rich, though not as concentrated. Ginger and garlic. Both improve circulation and have mild anticoagulant properties that support healthy blood flow. They also have the benefit of being anti-inflammatory, which matters because chronic inflammation is one of the silent killers of sexual function as we age. I'm not suggesting you eat raw garlic an hour before sex. That's a different kind of romance killer. But including these in your regular diet and in meals several hours before sexual activity provides measurable benefit. Beets. Another nitric oxide booster, beets have been shown to lower blood pressure and improve exercise performance, and the same vascular benefits apply to sexual function. Beet juice, beet salad, roasted beets, all legitimate options for supporting your body's capacity for arousal. Now here's something that's going to challenge you. Red wine. In moderation. 1 glass, not 3. Not a bottle. 1 glass of red wine contains resveratrol and other polyphenols that relax blood vessels and reduce anxiety. The key word is moderation. Because alcohol in larger amounts is a nervous system depressant that will absolutely impair sexual function. But the cultural prohibition against women drinking before sex often comes from purity culture. Not from physiology. A single glass of quality red wine for a healthy adult woman can be part of a pleasurable sexual experience. I'm giving you permission to stop feeling guilty about that. But let me tell you what works against you. What actively sabotages your sexual response and creates the very dysfunction you're trying to avoid. Sugar. Excessive sugar creates insulin resistance, inflammation, oxidative stress, and blood sugar crashes that leave you exhausted and irritable. It damages blood vessels over time. It creates hormonal chaos. If you're eating a high-sugar diet and wondering why your arousal feels sluggish and your orgasms feel muted, this is why. Alcohol in excess. I already mentioned this, but it bears repeating. More than 1 or 2 drinks creates nervous system depression, dehydration, and impaired judgment that often leads to sexual experiences you wouldn't choose sober. If you need 4 drinks to feel comfortable with sexual pleasure, the problem isn't your body. The problem is either trauma that needs addressing or a relationship dynamic that doesn't feel safe. Alcohol is not the solution. Processed foods filled with trans fats and inflammatory oils. These damage your vascular system, create oxidative stress, and contribute to the chronic low-grade inflammation that interferes with every aspect of sexual function. If it comes in a package with an ingredient list longer than your arm, it's probably not supporting your sexual health. Excessive caffeine. I know this one hurts. I drink coffee too. But if you're consuming caffeine all day long to compensate for inadequate sleep and poor nutrition, you're keeping your sympathetic nervous system, your fight-or-flight response, chronically activated. Sexual arousal requires parasympathetic dominance. You literally cannot be in fight-or-flight mode and sexually receptive mode simultaneously. Your nervous system has to choose, and if you're flooding it with stimulants, it's going to choose vigilance over vulnerability every single time. Let me tell you about Margaret, who was 61 when she came to see me reporting complete anorgasmia, the inability to orgasm, for over 3 years. She'd been to multiple doctors, tried various supplements, read countless articles. No one had asked her about her caffeine intake. She was drinking 6 to 8 cups of coffee daily, plus energy drinks in the afternoon. Her cortisol was sky high, her nervous system was fried, and her body was quite literally too stressed to allow pleasure. We tapered her caffeine down to 2 cups in the morning only, supported her adrenals with adaptogenic herbs, improved her sleep hygiene, and within 2 months, she was orgasmic again. Not because we did anything complicated, because we stopped poisoning her nervous system with stimulants. Here's what I want you to understand about the relationship between nutrition and sexual function. Your body is not betraying you. Your body is responding exactly as it should to the inputs you're giving it. If you feed it inadequate protein, if you starve it of essential fats, if you flood it with sugar and stimulants, if you keep it in a chronic state of nutritional stress, it will prioritize survival over pleasure. That's not dysfunction. That's biological wisdom. The tragedy is that we live in a culture that taught women to be suspicious of their appetites, all of their appetites. We were taught that wanting food meant we were weak, that wanting sex meant we were inappropriate, that prioritizing pleasure meant we were selfish. So we learned to ignore our hunger, suppress our desire, and apologize for taking up space. And then we wonder why our bodies stopped responding with enthusiasm to our occasional guilty attempts at self-pleasure. Masturbation, when we're talking about it clinically, is one of the most important practices for maintaining sexual function throughout your lifespan. It's not frivolous, it's not indulgent, it's not something to feel ashamed about. Regular sexual activity, whether partnered or solo, maintains blood flow to genital tissues, keeps nerve pathways active, supports hormonal balance, and reinforces the neural circuits associated with pleasure and arousal. Use it or lose it isn't just a saying, it's physiology. But if you're going to engage in self-pleasure, if you're going to invest that time and energy in maintaining your sexual function, doesn't it make sense to prepare your body nutritionally so that the experience is actually pleasurable rather than effortful? Doesn't it make sense to give yourself every possible advantage? Here's a practical protocol I've developed with patients over the years. About 2 to 3 hours before you plan time for self-pleasure, eat a meal that contains quality protein, healthy fat, and some complex carbohydrates. For example, salmon with avocado and quinoa, or a 3-egg omelet with vegetables cooked in olive oil and a slice of sprouted grain toast, or grass-fed beef with roasted vegetables and sweet potato. You want about 25 to 30 grams of protein, 15 to 20 grams of healthy fat, and moderate complex carbs for sustained energy without a blood sugar spike. About 30 to 60 minutes before, if you want to optimize further, have a small snack that specifically supports nitric oxide production and blood flow. This could be a handful of dark chocolate and some watermelon, or a small glass of beet juice, or some maca powder mixed into coconut milk. These are targeted interventions that work with your physiology rather than against it. Make sure you're adequately hydrated. Dehydration impairs every aspect of sexual function, from lubrication to orgasmic intensity. If your urine is dark yellow, you're not drinking enough water. It's that simple. Avoid eating a massive meal right before sexual activity, because your body will be diverting blood flow to digestion rather than to your genitals. But also avoid trying to experience pleasure on an empty stomach or while in a fasted state, because your blood sugar will be low, your cortisol will be elevated, and your body will be in stress mode rather than relaxation mode. Now let's talk about something that makes many women uncomfortable: the connection between nutrition, body image, diets, and sexual pleasure. I've had countless patients tell me they can't enjoy masturbation or partnered sex because they're too distracted by negative thoughts about their bodies. They're focused on their stomach, their thighs, their breasts, their cellulite. They're performing rather than experiencing. They're watching themselves from the outside rather than feeling themselves from the inside. And here's the truth that nobody wants to acknowledge. Chronic dieting, chronic restriction, chronic body hatred don't just harm your mental health. They harm your capacity for physical pleasure. When you're malnourished, when your body fat is too low, when your hormones are suppressed from inadequate caloric intake, you lose your libido. You lose your capacity for arousal. You lose the padding that makes certain sexual positions comfortable. Your tissues become thin and fragile. Your lubrication decreases. Your orgasms become weaker or disappear entirely. The diet industry has convinced women that thinness equals sexiness, but physiologically, extreme thinness equals decreased sexual function. Your body needs adequate energy stores, adequate body fat, adequate hormone production to support robust sexual response. The aesthetic ideal we're sold and the biological reality of sexual function are often in direct conflict. I'm not telling you to gain or lose weight. I'm telling you that your worth, your desirability, and your capacity for pleasure have nothing to do with the number on a scale and everything to do with how well you're nourishing the body you have right now. When you feed yourself adequately, when you move your body joyfully, when you sleep enough, when you manage stress, your sexual function improves. Not because you've achieved some aesthetic ideal, but because you've met your body's basic needs. There's something else we need to address, and it's going to make some of you uncomfortable: the relationship between trauma, dissociation, and sexual function. I've worked with many women who've experienced sexual trauma, and one of the ways that trauma manifests is in a disconnect between mind and body during sexual activity. You're physically present but mentally elsewhere. You're going through the motions but not feeling the sensations. This is a protective mechanism, a way your nervous system learned to keep you safe during overwhelming experiences. Healing from sexual trauma is complex and typically requires professional support. But nutrition plays a role here too. Trauma dysregulates your nervous system, often leading to chronic activation of your stress response. The same nutritional strategies that support nervous system regulation, adequate protein for neurotransmitter production, omega-3 fats for brain health, magnesium for nervous system calming, B vitamins for stress resilience, these also support your capacity to be present in your body during sexual activity. Additionally, blood sugar stability matters enormously for trauma survivors. When your blood sugar crashes, it can trigger a physiological stress response that feels identical to the arousal of your trauma response. Eating regular, balanced meals that prevent blood sugar fluctuations can significantly reduce the frequency of these triggering moments and make it easier to remain present and regulated. I want to take a moment to address something that's often left out of these conversations: the role of the gut-brain axis in sexual function. Your gut produces approximately 90% of your body's serotonin, a neurotransmitter crucial for mood regulation and also involved in sexual response. Your gut bacteria influence inflammation levels, hormone metabolism, neurotransmitter production, and even your stress response. When your gut is unhealthy, when you have dysbiosis, intestinal permeability, chronic inflammation in your digestive system, it affects your brain, your hormones, and yes, your sexual function. Women with irritable bowel syndrome report higher rates of sexual dysfunction. Women with inflammatory bowel diseases report decreased libido and arousal difficulties. This isn't coincidence. It's the gut-brain genital axis, and it's all connected. Supporting gut health means eating adequate fiber from vegetables, fruits, and properly prepared grains or legumes. It means including fermented foods like yogurt, kefir, sauerkraut, or kimchi. It means avoiding excessive antibiotics when possible and being cautious with anti-inflammatory medications that can damage the gut lining. It means managing stress because chronic stress absolutely destroys gut health. Let's talk about supplements for a moment. I'm generally not a supplement pusher because I believe food should be your primary source of nutrition, but there are certain supplements that have good evidence for supporting sexual function, particularly as we age. Magnesium. Most Americans are deficient, and magnesium is crucial for nervous system regulation, muscle relaxation, and blood vessel function. It can improve sleep quality, reduce anxiety, and support the parasympathetic state necessary for sexual arousal. I typically recommend magnesium glycinate, 200 to 400 milligrams before bed. Omega-3 fatty acids. If you're not eating fatty fish at least 3 times weekly, you should consider supplementation. Look for a high-quality fish oil or algae-based omega-3 that provides at least 1,000 milligrams of combined EPA and DHA daily. These reduce inflammation, support brain health, improve mood, and enhance vascular function. Vitamin D. Deficiency is epidemic, and low vitamin D is associated with decreased libido, mood disorders, and impaired immune function. Get your levels checked and supplement if necessary to achieve blood levels between 50 and 80 ng/ml. B-complex vitamins. Essential for energy production, neurotransmitter synthesis, and stress resilience. If you're experiencing fatigue or brain fog along with decreased libido, B vitamins might help. Adaptogenic herbs like ashwagandha, rhodiola, or holy basil can support your stress response and improve resilience without being stimulating. These are particularly helpful for women who are chronically stressed and having difficulty downregulating their nervous system. But here's what supplements cannot do. They cannot compensate for a fundamentally inadequate diet. They cannot override the effects of chronic stress, poor sleep, and sedentary living. They're supplemental, not foundational. The foundation is real food, adequate sleep, movement, stress management, and connection. Everything else is just supporting that foundation. I want to circle back to something I mentioned earlier because it's so important: the difference between intensity and intimacy. Many women have confused these two things, particularly if they learned about sexuality through relationships that were dramatic, unstable, or traumatic. The adrenaline rush of chaos, the dopamine hit of intermittent reinforcement, the intensity of anxiety-provoking attachment, these can feel like passion when they're actually just nervous system dysregulation. Real intimacy, real sustainable pleasure, requires safety. It requires a regulated nervous system. It requires being able to access your parasympathetic state, which is impossible when you're running on cortisol and adrenaline. And this is where nutrition comes back into the picture, because maintaining blood sugar stability, supporting your adrenal glands, providing your nervous system with the nutrients it needs to function properly, all of this makes it possible to experience pleasure without drama, arousal without anxiety, intimacy without intensity. If you've spent years in relationships where sex was best when you were fighting and making up, where the most intense orgasms came from the most unstable dynamics, I want you to know that's not your sexual peak. That's trauma bonding. That's your nervous system mistaking danger for excitement. Real pleasure, sustainable pleasure, the kind that doesn't leave you emotionally devastated afterward, comes from safety and regulation, not from chaos and intensity. Learning to experience pleasure in calm, safe contexts might actually feel boring at first if you're used to intensity. Your nervous system might not know how to interpret safety as exciting, but with practice, with patience, with intentional nervous system retraining, you can learn to access arousal and pleasure without needing drama to jumpstart your system. And proper nutrition is part of that retraining process. Let me tell you about Carla, who was 58 and had been divorced for 3 years. She came to me because she'd started dating again and discovered that she couldn't orgasm with her new partner despite having no trouble during masturbation. The sex was good, he was attentive, she felt safe with him, but her body wouldn't respond the way it did when she was alone. As we talked, it became clear that Carla had spent 20 years in a marriage characterized by drama, intermittent affection, and significant emotional instability. Her most intense sexual experiences with her ex-husband had come during periods of conflict and reconciliation. With her new partner, there was no conflict. There was just consistent kindness, safety, and affection. Her nervous system literally didn't know how to interpret that as sexually arousing because it had learned that arousal required adrenaline. We worked on several things simultaneously: nervous system regulation techniques, reframing her understanding of arousal, and, relevant to our conversation today, optimizing her nutrition to support parasympathetic nervous system function. We increased her magnesium intake, added adaptogenic herbs to help her stress response become more flexible, ensured she was eating adequate protein and fat to support neurotransmitter production, and worked on blood sugar stability to prevent the cortisol spikes she'd been using as a kind of self-stimulation. Over several months, Carla's nervous system learned to access arousal without danger cues. Her orgasms with her partner became not just possible, but actually more profound than the intensity-driven ones she'd experienced in her marriage. She described them as deeper and more whole body, rather than sharp and localized. This is the difference between intensity and intimacy, between nervous system dysregulation masquerading as passion and genuine, embodied pleasure. Now I want to address something that comes up frequently with women in midlife, the fear that decreased sexual function is inevitable, that it's just part of aging, that there's nothing to be done about it. This is one of the most damaging myths in women's health, and I'm going to be very direct with you about this. Yes, hormonal changes occur with menopause. Yes, these changes can affect sexual function. But the dramatic decline in sexual function that many women experience is not inevitable. It's the result of multiple factors: inadequate nutrition, chronic stress, sedentary lifestyle, medications that interfere with sexual response, unaddressed relationship issues, internalized shame about aging sexuality, and lack of regular sexual activity maintaining those pathways. Study after study shows that women who maintain regular sexual activity, either partnered or solo, maintain better sexual function throughout their lifespan. Women who prioritize nutrition, sleep, stress management, and movement maintain better sexual function. Women who address hormonal changes with appropriate interventions when necessary maintain better sexual function. This is not about being lucky or having good genes. This is about making choices that support your biology rather than working against it. And here's something that might surprise you. Many women report that their sexual satisfaction actually increases in midlife and beyond. Not despite aging, but because of the wisdom, confidence, and self-knowledge that comes with age. You know what you want. You're less concerned with performance. You're more comfortable advocating for your own pleasure. You've hopefully shed some of the shame and inhibition that plagued you earlier. These are enormous advantages. The question is whether your body will be able to keep up with your increased wisdom and willingness. And that's where everything we've been talking about comes in. If you prepare your body nutritionally, if you maintain the pathways through regular sexual activity, if you address issues as they arise rather than accepting dysfunction as inevitable, there's no reason your sexual function at 60 should be dramatically worse than it was at 30. Different, yes. More reliant on lubrication, possibly. Requiring more direct stimulation, perhaps. But worse? No, not necessarily. I want you to think about something. Men have had access to Viagra and Cialis for decades. The entire medical establishment mobilized to ensure that male sexual function could be maintained throughout the lifespan. Meanwhile, women's sexual dysfunction has been pathologized, ignored, or attributed to psychological issues rather than recognized as a legitimate medical concern deserving of intervention. I'm not saying we need a pink Viagra, though medications for female sexual dysfunction do exist and can be helpful for some women. I'm saying we need to stop accepting the narrative that women's sexual decline is inevitable and natural, while men's sexual decline is a medical emergency requiring pharmaceutical intervention. Both deserve attention. Both deserve resources. Both deserve the acknowledgement that sexual function throughout your lifespan matters, and that there are evidence-based interventions available. And for many women, those interventions don't require pharmaceuticals. They require adequate nutrition, hormone optimization when appropriate, treatment of underlying conditions affecting sexual function, pelvic floor therapy if there are structural issues, addressing relationship dynamics if those are contributing, and permission to prioritize their own pleasure. That last one might be the most important. Permission. So many women I work with are still waiting for permission to prioritize their own pleasure, to take time for self-care, to invest in their own sexual health. They'll move heaven and earth for their children, their partners, their aging parents, their careers, but spending 20 minutes on self-pleasure, taking supplements that support sexual function, eating in a way that optimizes rather than just sustains, these feel indulgent, selfish, inappropriate. I'm giving you permission right now. Your pleasure matters. Your sexual function matters. The quality of your embodied experience matters. You don't need to earn it. You don't need to wait until everything else is handled. You don't need to apologize for taking up space and having needs. Your body is not an inconvenient machine that should quietly perform without complaint. Your body is the vessel through which you experience your entire life, and it deserves to be nourished, tended, and allowed to experience pleasure. Let's talk practically about implementation, because information without application is just entertainment. You're going to leave this video with specific action steps, or we've both wasted our time. First, conduct an honest audit of your current nutrition. For 3 days, write down everything you eat and drink. Don't change your habits, just observe. Then look at your protein intake. Are you getting at least 20 to 30 grams at each meal? Look at your fat intake. Are you including quality fats at each meal, or are you still eating low-fat everything? Look at your sugar and processed food intake. Be honest about what you're actually consuming versus what you think you're consuming. Second, identify your barriers. What's preventing you from eating in a way that supports your sexual health? Is it time? Is it knowledge about how to prepare foods? Is it lingering diet culture beliefs? Is it lack of appetite because you've been restricting for so long? Is it digestive issues that make certain foods uncomfortable? You can't address barriers you haven't named. Third, make one change at a time. Don't try to overhaul your entire diet overnight. If you're currently eating minimal protein, start by adding one high-protein meal per day. If you're fat-phobic, start by adding avocado to your lunch. If you're drinking 6 cups of coffee daily, start by replacing 1 with herbal tea. Small, sustainable changes compound over time into dramatic improvements. Fourth, pay attention to how you feel. This is crucial. Start noticing the connection between what you eat and how your body responds. After you have that protein and fat-rich meal, do you feel more sustained energy? Does your mood stabilize? Do you notice improved mental clarity? And crucially, do you notice any changes in your libido, your arousal, your sexual function? Your body will give you feedback if you're paying attention. Fifth, consider working with a practitioner who understands the connection between nutrition and sexual health. Not all doctors are trained in this. Not all nutritionists understand sexual health. You might need a functional medicine practitioner, a naturopath, or a dietitian with specialized training. Don't be afraid to ask potential practitioners directly. Do you understand the relationship between nutrition and sexual function? Have you worked with women on these issues? Sixth, address other factors affecting your sexual health. Get your hormones checked if you're experiencing symptoms of hormonal imbalance. Get your thyroid function checked. Hypothyroidism absolutely affects libido and arousal. Get your vitamin D levels checked. Get adequate sleep because sleep deprivation destroys sexual function. Move your body in ways that feel good. Manage your stress through whatever means work for you. All of these factors interact with nutrition to either support or undermine sexual health. Seventh, maintain regular sexual activity. I cannot emphasize this enough. Whether partnered or solo, regular sexual activity maintains function. You don't have to do anything elaborate or time-consuming. Even brief sessions of self-pleasure several times weekly maintain nerve pathways, maintain blood flow, maintain hormonal signaling, maintain the neural circuits associated with arousal and orgasm. Use it or lose it is not a metaphor. Eighth, and this might be the most challenging, work on your relationship with pleasure itself. Many women carry so much shame, so much guilt, so many internalized messages about pleasure being wrong or dangerous or selfish. That shame lives in your body and interferes with your capacity to feel pleasure. You might need therapy to address this. You might need somatic work. You might need to gradually expose yourself to situations where pleasure is allowed and notice what comes up. This is deep work, and it matters. Let me tell you about Elena, who was 63 when she finally gave herself permission to prioritize pleasure. She'd spent her entire life being the good daughter, the good wife, the good mother, the good employee. She'd never done anything solely for herself, never prioritized her own needs, never even admitted she had needs. When she came to see me, she was so disconnected from her body that she couldn't tell me if she was hungry, tired, or in pain without significant prompting. She certainly couldn't access pleasure. We started with the most basic interventions: eating regular meals, getting adequate sleep, moving her body gently. Just meeting her basic physiological needs was revolutionary for Elena because she'd been overriding those needs for decades. As her physical health stabilized, we gradually introduced the concept of pleasure. Not sexual pleasure initially, just any kind of pleasure. The pleasure of a warm bath, the pleasure of her favorite tea, the pleasure of comfortable clothing. It took Elena almost a year before she could even consider exploring sexual pleasure without immediately feeling guilty or wrong. But once she gave herself that permission, once she started nourishing her body adequately and addressing her chronic stress and allowing herself to acknowledge her own desires, her capacity for pleasure expanded in ways she'd never imagined possible. She told me, with tears in her eyes, "I'm 63 years old, and I just had my first orgasm that felt like joy instead of guilt." That's what we're talking about here. Not just mechanical sexual function, though that matters. We're talking about your capacity to feel joy in your own body, to inhabit your physical experience without shame, to allow yourself to be fully alive in every sense, and nutrition is one of the foundations that makes that possible. Before we close, I want to address one more thing that's been implicit throughout this conversation, but needs to be explicit: the political nature of women's pleasure. I use the word political deliberately because the systematic suppression of women's sexuality, women's bodily autonomy, women's pleasure has been a tool of control throughout history. When women are disconnected from their bodies, when they're taught their pleasure doesn't matter, when their sexuality is defined in service to others rather than as something inherently valuable for themselves, they're easier to control. The diet industry, the beauty industry, the medical establishment's historical dismissal of women's sexual health concerns, these aren't accidents. They're features of a system that benefits from women being insecure, disconnected, and focused on meeting external standards rather than on their own embodied experience. Every time you prioritize your own nourishment, every time you choose to feed yourself adequately rather than restrictively, every time you invest in your own pleasure, you're engaging in a small act of resistance against that system. I'm not being hyperbolic, I'm being accurate. The reclamation of your body, your appetite, your pleasure is political work. And it's also deeply personal work. Both things can be true simultaneously. So when you eat that piece of dark chocolate before self-pleasure, when you include that avocado with your meal, when you take those supplements that support your sexual health, when you spend time exploring what brings you pleasure, you're not just improving your personal sexual function. You're participating in the larger cultural project of validating women's embodied experience, women's right to pleasure, women's ownership of their own bodies. This matters. You matter. Your pleasure matters. Your sexual health matters. Not because it makes you more attractive to a partner, not because it serves some reproductive purpose, not because it makes you younger or more valuable. Simply because you are a human being with a body capable of experiencing pleasure, and you deserve to experience that fully throughout your entire lifespan. Here's your homework for this week, your practical challenge. Plan one meal specifically designed to support your sexual health. Include quality protein, healthy fats, and some of the foods we've discussed that support blood flow and neurotransmitter production. Eat that meal 2 to 3 hours before you plan some time for self-pleasure. Don't approach it as a test or a performance. Approach it as an experiment. Notice what you observe about your arousal, your pleasure, your orgasmic response. Notice how it compares to times when you've approached self-pleasure poorly nourished or in a stressed state. Write down your observations. Share them with me in the comments if you're comfortable. Tell me what you discovered. Tell me what surprised you. Tell me what was challenging. Tell me what was revelatory. This is how we learn together, how we support each other, how we validate each other's experiences in a culture that would prefer we stay silent about these things. And please, subscribe to this channel so we can continue having these conversations. Share this video with other women who need to hear it. Leave a comment telling me what topics you want me to address next. Your engagement tells me these conversations matter, that there's hunger for honest, evidence-based information about women's sexual health that doesn't shy away from the difficult topics. I see you. I hear you. I know that many of you came to this video skeptical, maybe even embarrassed. I know that the title might have made you uncomfortable. Good. We need to be comfortable being uncomfortable when it comes to women's sexual health. We need to be willing to have explicit conversations about pleasure, about function, about what our bodies need and deserve. You are not too old. You are not too damaged. You are not too broken. You are not too anything to experience pleasure in your own body. Your body is waiting for you to come home to it, to nourish it properly, to give it what it needs, to allow it to show you what it's capable of when you work with it rather than against it. The conversation about sexual health is inseparable from the conversation about how we feed ourselves, how we care for ourselves, how much permission we give ourselves to prioritize our own needs. They're all connected, and when you start addressing one, you inevitably start addressing all of them. I've spent over 2 hours with you today because this matters that much, because women's pleasure matters that much, because your embodied experience matters that much. I hope you'll take what resonates, leave what doesn't, and most importantly, start having your own conversation with your body about what it needs to thrive. Thank you for being here. Thank you for being willing to engage with information that our culture would prefer remain hidden. Thank you for taking your own health, your own pleasure, your own embodied experience seriously enough to invest this time in learning. Now go eat something nourishing, and then go enjoy your body exactly as it is right now. You deserve nothing less.